I'm so happy to have the opportunity to converse with Dr. Jonathan Rosenthal. And can you all hear me?
It just, you froze for a moment.
Oh no, can you hear me now?
Yes.
Have both of you here for an opportunity to learn more conference that you're putting together, Jonathan. On that note, to help introduce give me a little bit of a background about what this conference is all about.
Sure. Todd, thank you so much for having me on. I really appreciate the invitation.
Yes.
And hello, everyone. So the Neuroscience and Yoga Online Conference is now the 9th year that I and a group of people have been hosting events related to neuroscience and yoga. And this is the 3rd year that we've hosted a large international conference. All of our previous events were small live events in New York City. And the conference is essentially my favorite way to celebrate Brain Awareness Week, which is a huge international celebration of neuroscience. And the conference tries to bring neuroscience of yoga, so the research of how yoga affects the brain, to everyone. And the way we do this is through different topic-themed days. Every day of the conference has a different topic. There are 4 days to the conference this year. And then each day has presentations from top researchers, but in a down-to-earth, understandable way. Yoga classes with top teachers. Experiments before and after the yoga classes, so you can see how does yoga affect me, my own neurophysiology, and also how do I compare to my peers, which is really fun competition. And then lastly, question and answer sessions, which are the opportunity to discuss what you learned in the presentations with the researchers. So the main topics this year, so the first day of the conference is an introduction, just to make sure everyone's on the same page. What is neuroscience? How do we study neuroscience? What are the parts of the brain we need to know? And then also, what is yoga? What are the parts of yoga? How do different yoga traditions compare? And then also an introduction in how to read a scientific abstract and how the conference works. So that's all the first day of the conference. And then each subsequent day is yoga and empathy, yoga and neurologic conditions like stroke and Parkinson's and neuropathy and more. And then yoga and trauma, which is a huge hot topic in the yoga world right now. I've spoken too much, so please jump in and ask others.
That's great. Thank you. You're my job very easy. And continue conversing like that. That's wonderful. When did you put the connection between your fascination with neuroscience and your passion for yoga? Which came first?
They were simultaneous but separate. So I don't know how I never put it together before, but when I was a teenager, I did a lot of summer programs in neuroscience. I really loved the brain, and if I really try to understand why I love the brain so much, I can't like put my finger on one moment where it kind of sparked, but I imagine it had something to do with when I was a child, my grandmother had a stroke and wasn't able to talk anymore. And I just, remember thinking about that and buying books about that and reading about that. So yeah, ever since I was a child, I was very interested in neuroscience. But then in high school, in 9th grade, we read Hermann Hesse's Siddhartha, which if people aren't familiar with that book, it's an older book that kind of is a fictional tale, but it's based on like Siddhartha Gautama. And the premise of the book really resonated with me. And I started reading about more Eastern philosophical texts and arrived on the Bhagavad Gita and the Yoga Sutras and was very interested in them, but never thought I would, take a yoga class because I thought it was just for women. And then I ended up injuring myself and taking a yoga class, and the rest is history. So then I was doing both separately until probably my 20s.
Nice. Very cool. And Sarah, I'm so happy to have you here. Thank you so much for setting this introduction up and for joining this evening. I've had the pleasure of meeting you, Sarah, here practicing in our studio. Can you explain, Sarah, what your role with the conference this year?
Yeah, so I'm a longtime yoga practitioner and meditator, and I met Jonathan online a few years ago when he was doing, I believe it was the first Neuroscience and Yoga online conference. So it was during the early pandemic, and I'm also fascinated with the brain, and I would say my interest with the brain and its workings and how it relates to yoga was, it really blossomed during a month-long teachers intensive with Richard Freeman and Mary Taylor, because their month-long intensives include cadaver labs. And so we had regular cadaver labs during that month. And I had the opportunity to hold a human brain in my hand and look at eyeballs and the circuitry and have, like, you know, a pituitary gland, tiny pituitary gland in my hands. And it gave me this, it just opened up the world of neuroscience for me, truly. And so I was really interested when I heard about Jonathan's conference, and I've been a big fan. And Todd, I've been to your studio before. I know that we share some teachers in common, and like Tim Miller. So I just thought it was a perfect way to have worlds collide, so to speak, and get the word out about Jonathan's conference, which I deeply believe in, disseminating the information that Jonathan is bringing experts in from all over the world. Like, I love how it's so diverse and worldwide, and people are participating from the northern and southern hemispheres, and it's just building bridges amongst not only the yoga community, but the science and yoga communities together, which I find really valuable. So
nice. That's cool.
And Sarah also keeps me on task when I suggest crazy things for the conference.
Well, what's an example of a crazy thing that you've tried to get past Sarah on that?
I really shouldn't be allowed to design websites or anything that has to do with design or copywriting. Those are the main things that I need help on from Sarah.
Who did the website design? I thought you did a great job. Was that not you? Did you hire somebody professionally outside of your expertise, or did you put that together?
Great question. So I bought a template and then filled in the details. And then Sarah told me whenever anything I wrote was stupid.
Nice. We don't need an editor for sure. That's cool. Jonathan, I'm curious. So currently you work as a physician at a hospital in New York. Is that correct?
That is correct. I'm in my last year of neurology residency. And so I am a neurologist. So I mostly see patients with like stroke and epilepsy and Parkinson's and multiple sclerosis and neuropathy and stuff like that. And it's kind of different than, this conference or this interest that I have. So I'm really like excited and happy that I get to pursue it in this way.
That's cool. What are you observing in the field these days? Like having your hands in this, working with people on a daily basis. What are some observations that you're noticing?
So I think that the world is coming back to life now. I mean, I started residency before COVID, so I was lucky that I was able to, practice medicine before COVID. And then COVID happened during my first year of residency. And, I guess the middle part of my residency was very COVID focused. And now I really feel like everyone's kind of back to normal. Like we don't really have televisits anymore. I get to see all my patients in person. We actually just had a rule change in the hospital where we don't have to wear masks anymore. It's crazy. Yeah. You know, I know a lot of places before had removed their mask policy, but hospitals were always like, no, we're keeping this. And it just suddenly we got an email and they were like, it's over. So yeah, my observations on the ground are kind of this sense of normalization.
Yeah.
And then with that comes a crazy amount of volume.
Of work.
Of work.
A volume of work, right? Because people weren't coming into the hospital before. People that have neurological issues that maybe stayed away are now coming to.
Yeah, I definitely think that that's a part of it, that there was a delay in care for a lot of people. And now that's kind of, you know, being addressed.
What does post-residency look like?
So my clinical interest is in epilepsy and neurophysiology. And clinical neurophysiology refers to like EEG, intraoperative monitoring, so all these electrical diagnostic studies. And so I'm doing a fellowship in EEG and other neurophysiologic studies.
Wow, that's cool.
Yeah, I'm so excited. It's going to be great. So the hospital, I'm switching hospitals, but I'm going to one nearby. It's like 30 blocks away. So I'm just going to walk there. I get to stay in my apartment.
Nice. Okay, that sounds amazing. I hear ya. You mentioned that during the conference that there's going to be ways that you're going to test the participants to give a sense of like, is the yoga having effect on me? Is there some way of measuring how my yoga practice might be having an effect on me? What are some examples of what type of tests will you be doing?
Yeah, so neuroscience exists at 7 main levels. And just to name some of them, so there's, you know, the molecular level, the cellular level, those include the genetic level, network levels, and then also like behavioral and cognitive levels. And so it's hard to do kind of like cellular experiments in humans in general, but especially over the internet, right? We'd need to collect samples and then send them all to like one lab, and that would just be crazy difficult to do. But what we tend to do is cognitive type experiments over the internet, as well as some physiologic experiments like heart rate variability.
So I'm going to interject a second, because this is like one of the most fun aspects of this conference is the opportunity to participate. And the fun thing is that, you know, most everybody has a phone, and Jonathan uses an app that you can download to measure heart rate variability. That's one of the experiments is heart rate variability. And you get to measure both before a class and after a class, and then see the differences. I just had to interject though and say how fun it is.
Yeah. No, cool. It's probably my favorite part too, because then what we're really doing is validating the scientific research that's been done and showing like, how does science work? Like you get to be a subject in a study that you're contributing to, like in a kind of, you're not exactly designing it, the participants, but they get to see why it was designed the way it was. And in the context of all the presentations, they're really seeing how it compares to the rest of the scientific literature. And then, like I said, at the end, you get like a table comparing yourself to everyone else.
Example typically happens with people's heart rate variability when it's measured before practice and post practice.
Yeah, so the effects on heart rate variability are pretty reliably dramatic, which, you know, implies that yoga has a profound effect, even with just one class, on the autonomic nervous system, which is the part of the nervous system that regulates resource distribution, is the way I like to think about it. So are you allocating resources towards, you know, muscles, meaning you're going to move, you're going to run, you're going to race, you're going to fight, or are you allocating resources towards things like digestion, relaxation, rest, recovery? And what we reliably see is in heart rate variability, the trend after yoga classes tends to be an increase. So an increase in heart rate variability implies increased parasympathetic nervous system activity and more of that rest and digest state. And, you know, there's way more to talk about, like what this actually means. I think everyone always talks about, like, you know, we focus on like, oh, that means that there's more vagus nerve activity. But the more interesting part is that that reflects changes in brain activity and also that reflects changes in so many other bodily functions. So yeah, there's a whole presentation this year by Dr. Raj Bhandari on yoga and trauma through the vagus nerve. She's like an expert in vagus nerve anatomy and physiology. Her whole lab is about the vagus nerve. So it should be really interesting.
Very cool. And I also want to mention anyone that's watching on YouTube Live now or via one of the other social media platforms, if you have any questions for us or for Sarah and specifically for Jonathan, please type the comments in and I'll happily relay the message and we'll do our best to answer. So please feel free to interact. I'm curious, Jonathan, I feel like that's a really popular term. Reading about that's something that's like a buzzword, but can you say if I'm listening and I've never heard the term vagus nerve, can you give us a little bit of what that means?
Yeah. Am I allowed to grab a model brain that I have?
That'd be amazing. Yeah, please.
Yes.
Just not a human version like you mentioned, Sarah. Like maybe that freaks him.
We used to bring a human brain to all of the neuroscience and yoga in-person events.
Oh, wow.
And we had this, it was a brain that a patient donated out of the kindness of their heart. They had Alzheimer's. And so it's a really great example of, you know, the changes that happen with Alzheimer's. It was a really excellent learning opportunity. Wow. So this is my little model brain. And so the brain has a lot of different parts, but I think the main thing is like someone's really new to this to understand is that the brain processes things in sequence. So it's layered, meaning like information isn't processed at once. It goes through many layers in order to extract information that we use from it. And the cortex is this gigantic part of the brain up here. And there's so much going on up here, like vision, hearing, touch, thinking, memory. But here missing is the spinal cord, which is what would connect to the rest of the body. And then this is the brainstem. Nice.
Can you see that? This is kind of the extension of what he's talking about.
Yep. That's the full extent of the vagus nerve. And the vagus nerve arises from the brainstem here. So it's really going to arise from the medulla. So this part right here. And it communicates with all of the internal bodily organs. It really doesn't go to any external structures. But besides just the internal bodily organs, it does some weird things. Like there's a branch of the vagus nerve that goes to the speech box and helps with speech. And so sometimes if people have injury to the vagus nerve, they'll have paralysis of the vocal cords. And that branch of the vagus nerve is so weird. It it goes all the way down, loops around the aorta, and then comes back up to go to the voice box. It's so weird. But then the rest of this vagus nerve goes to the heart, the lungs, the digestive system, the pancreas. And it's vagus literally means wandering because it just wanders all over the body. And this nerve has become a kind of model of mind-body connection. And so it's really interesting for people trying to understand how mind-body practices work because it directly physically links the mind and the body. Of course, there are many mechanisms by which mind-body practices work, but the vagus nerve is a very prominent one.
Cool.
I'm just going to put this up again because it's so cool.
Yeah.
When you mentioned the one that was really odd, are you to the voice box, the fact that it travels down below the heart and loops back up, that the question would be, why would it travel so far if it is that?
Yeah. So it does that in every organism too. Like even in a giraffe whose neck is incredibly long, it goes all the way down, finds its way to the aorta, loops around, and then goes back up to the voice box.
Interesting.
It's very bizarre. It's just kind of whenever an evolutionary, I guess, whenever a developmental process is programmed, like there's a certain way it's programmed. And the way the vagus nerve must be programmed when it's developing is wrap around the aorta.
Mm.
Wow, that's fascinating.
Is there any theories about?
I am sure there are. I don't think I know them.
I was curious. Yeah. Interesting. In relation to specific yoga practices, I mean, I can think that obviously if we do like a yoga, like an asana or a yoga posture practice, that because we're just improving and getting some cardiovascular exercise. And then obviously we have this whole branch of practicing breathing and or having different breathing exercises to have a different type of effect on the nervous system. What are you noticing if I want to specifically try to engage with the vagus nerve, which obviously is going to happen no matter what, but are there specific to be more beneficial or proactive, having a positive effect?
Yeah, this is a really good question. Like, what are the necessary and sufficient components of yoga in order to have vagus nerve activation? And the answer is I can only the evidence we have only allows me to partially answer it. So I can't directly compare specific postures. I can't say like headstand versus shoulder stand, this is the effect on vagus nerve activity. But what I can say is there are definitely certain breathing patterns that have this effect. And what it really comes down to is the duration of exhalation. Longer exhalation than inhalation is what seems to be one of the main driving factors in vagus nerve activation.
Mm.
Now, does that mean that the postures without the breathing don't have that effect? I don't know. I don't think that study has been done. What you would really have to do is put someone in an asana sequence and not allow them to slow down their breathing and slow down their exhalation and see if they have any effect on heart rate variability.
Mm.
And if they have a small effect, but not as big as it was before, that suggests that the asanas do have some contribution to the increase in heart rate variability, but obviously not as much without the breathing.
Interesting. That's cool. That's amazing. Are you getting a feeling that maybe like if we look around the yoga world, we might see people not having a lot of experience and therefore maybe like the professionalism of the yoga as a teacher and or someone deriving their income from being yoga, this feeling that we need to blend the medical community and educate yoga teachers and practitioners to the science side of it to build the professionalism. Is that part of your mission in relation to this conference to kind of bridge that gap between the yoga world and the medical world?
Definitely a mission is to bridge the yoga world and the medical world, the science world. And to what purpose? I mean, I think there are many, but the thing that comes to my mind is when I first started realizing the connection between yoga and neuroscience and starting to pursue this, not because of how anyone treated me, but in my own mind, I started to feel like a scientific pariah. I was like, am I like esoteric and like woo-woo because I'm, thinking about studying yoga? And I think really what it came down to after years of like thinking about this is like, there's one truth. There's only one like truth in the world, and we're trying to uncover that. And, there are truths about yoga and there are truths about science, and we have to merge it and understand it together.
Nice.
And so I do think that bridging the neuroscience world and the yoga world works towards that. And the other thing is yoga as an intervention is very powerful. So for example, progressive muscle relaxation, which is very similar to like a yoga nidra practice, is level A evidence in migraine, meaning that it has the same level of evidence as many of the medications that we would prescribe as the first line. And when I say level of evidence, that means that it's been studied in large randomized controlled trials, the gold standard type of study, in order to say like how effective is it and who is it for.
And as a less invasive means and without negative repercussions or adverse effects.
Exactly.
Which is why it's so important.
It's so important to get the education about that out, because exactly, like people could do something that they want to. Of course, some people may want to take a medication, right? That's great. But some people may want to practice yoga. That's great, right? We should have the option for people if we know that the evidence is there. And I am so used to people not taking medications. It's so common for patients to not take their medication. I had a guy today in clinic who, he had these events where he like kept losing consciousness. I actually don't think they were seizures ultimately, but he was placed on Keppra, and I'm trying to take him off of Keppra slowly because I don't want to risk him having another event and getting injured. All it takes is to have an event while you're waiting for the subway. I had someone fall into the tracks and have their legs amputated, right? Like you can't let that happen. But he didn't take his medication for 2 weeks because he was like, I didn't feel like it. And I was like, well, if you didn't have an event for 2 weeks off of Keppra, that supports my argument that these weren't seizures to begin with. So yeah, people don't take their medications all the time. And so if they had another option, maybe they would pursue treatment more.
Yeah.
There's the flip side of that also, where there's a lot of people who are on multiple medications, and there can be, if you're adding to that cocktail of medications, there can be all sorts of contraindications. And yoga happens, again, just to be something that is less likely to cause any adverse reaction. And just to step in here and share why I also find this really valuable is because sort of circling back to Jonathan's comment about yoga being known for woo-woo, esoteric kind of practices, it legitimizes the yoga. And for people who are religious or who are thinking, for example, misunderstanding that you have to be Hindu or practicing Hinduism to participate in yoga, there are some of these misconceptions, whereas yoga, you don't have to be a practicing Hindu. Of course, there's roots, and we've got to acknowledge the origins of yoga, but you can still benefit from doing the practices without some of the other aspects of the practice, such as like chanting mantra or learning Sanskrit or things of that nature. You don't necessarily have to incorporate those things to receive benefit from it. And we've got an epidemic, speaking to trauma, we've got an epidemic, especially in young people, with anxiety and depression. And while hospitals or places of business might now be seeming more like back to normal, I think what's happened post-COVID and as a like the residue of COVID, even if we're back amongst, we're integrated and we're in public spaces again with other people, and maybe the masks are off, there's still this residue of trauma where people have been isolated, people have gotten depressed, especially in women. There's been increased instances of abuse of alcohol specifically. There's a lot of issues that are stemming from trauma from COVID and from other things. There's so many things. And especially with the youth, it's really problematic. And the numbers of youth that are struggling right now is really, it's dangerous. And if we can offer, and like we as a humanity, as a society, as a culture can offer practices that will be of benefit, and if school boards and municipalities will adopt these and integrate them into public school system curriculums, for example, like this is one of the benefits I see of a conference like what Jonathan's so skillfully put together, is there's ripple effects of what this kind of union of science and yoga can bring to not only the United States, but all over the world, because there's so much suffering right now. And this is a good, this is one good way to help mitigate some of that suffering.
And bring the evidence so they can bring it to those school boards and make the cases they need to make.
Exactly.
Great points.
I will also add about the side effects and risks of yoga. Really interestingly, they've been studied, meaning just like we study the risks of medications, which is really important, you should also, if you're going to tell people to do yoga, know what the risks of yoga are. And they're actually even lower than other forms of exercise. So there are case reports of some really serious injuries happening with yoga, often kind of these progressive fractures that occur with pushing too far. And other than that, in the main randomized controlled trials that have been conducted, it'll be knee pain for a week. That's the side effect of of a yoga class that they took, and then it's gone. And so the risks seem to be really low for yoga.
Great point. I noticed, Jonathan, that I was able to go onto your website for the conference, very easily sign up. I also noticed that there was no fee for me to sign up, that it's essentially anyone can join in, but then there's different tiers of if we want to donate and or invest in the conference, that there's different tiers. Can you explain a little bit about how all that?
Yeah, I can definitely talk more about that. So Brain Awareness Week is all about bringing neuroscience to everyone. When we used to do in-person events, we had a physical space to rent. So we would charge $5 to $10 for everyone who came. And with the internet, it's much more scalable. And so it's an opportunity to really get information to everyone. So the conference is offered donation-based. So we do, if people want to stay at the base tier, the presentation access pass, then we do ask them to donate. Most people don't, which is okay, but it's suggested to donate. And that includes all of the presentations. So anyone who joins the conference can have access to all of the presentations by top expert researchers without any limitations from fund availability.
Nice.
And then
That's amazing. Yeah. I'll let you continue though. I have another question, but I'll let you finish first.
Okay, I'll be quick. So then the tiers that go up from there add more features. So the live access pass adds the yoga classes, the experiments that we talked about before and after the yoga classes, and the question and answer sessions. So those are all of the live events, the ones that take place kind of synchronously. And then the lifetime access pass is really, it's almost like a mini teacher training or something like that. It's really designed for people who are trying to really dive deep into the knowledge. It comes with workbooks, which I think is super cool, that are essentially the content of the presentations with pieces missing. And as you're going through, you're supposed to fill it in. And then you walk away with it first, having turned passive listening into active learning. But then you have a textbook. This is your reference book for whenever you need to get back to this material. It also comes with lifetime access to the recordings and Yoga Alliance continuing education credit.
Very cool.
I want to say something really quick about the lifetime access pass, because I find that to be the best of the options for me. I'm pretty busy, and unfortunately, I'm not able to always participate as the live events are occurring. And what I love about the lifetime access pass is that I can, at my leisure, when I've got a gap of free time, I can dig in to some presentations or do one of the yoga classes, do the experiments, etc. And then I've got it available to me, just like I've got all these books on my bookshelf that I'll refer to time and time again. I love the fact that I can go back and back again, and I've integrated information from the conferences, because I've participated now a few years in a row, and I've certainly integrated the teachings and the wisdom I've learned and the knowledge I've accumulated from the conference material into my yoga teaching, the classes that I offer, and just my life. It's so valuable, and it's still a pretty nominal fee for what you get. So I just want to share that if people have the means to participate at that level, it's really valuable, because essentially, like Jonathan said, it's like a textbook. You get to go back and sometimes, it takes a little bit to digest a lot of information, and the conference has a lot of information. So
I was blown away by the list of people that you've been able to get to present at the conference, like Dharma Mittra, Eddie Stern. What is the woman that, is it called Body Medicine?
Tiffany Cruikshank.
Yeah, I just heard about her recently. Can you tell me a little bit about what her work, or how you met her and got her involved?
So she runs an organization called Yoga Medicine, and they do a lot of classes and workshops and teacher trainings on yoga as an intervention for different health benefits. And she actually participated in the conference last year, and we connected that way. And as I went through her stuff, I thought she would be a fantastic contributor this year with a lot of expertise. So yes, I feel very lucky. And sometimes I don't know how it happens that the people who participate end up participating. I'm incredibly grateful.
I read that you're a student of Dharma Mittra.
I am a student of Dharma's. I've been going to Dharma since 2011.
Very cool. I've only had a teaching at a conference here in Fort Lauderdale, but I had a really great. I thought that was cool that you've been able to get him to participate as well.
Yeah, he's one of the coolest people I know. I think he's really awesome.
Nice.
Dharma is 83 years old and is more flexible than I am. I'll just say that. Like, he's so impressive. He's what a great example of how yoga can be of benefit and keep you youthful as you age.
Yep.
Agreed. He's amazing. That's a list of people that participate. I was really curious. You piqued my interest that when you made mention of the different type of diseases that you're working with, Jonathan. My mom was a nurse, and she worked for the Epilepsy Foundation here in Palm Beach County. And then she actually got Alzheimer's, and she passed away last year from Alzheimer's. Thank you. And she came and practiced studio 5 days a week we've been here for, it'll be 17 years in April. So she came, and so I slowly watched, and we hold down a Mysore program, or Ashtanga program. So, that's a type of yoga practice that is very dependent on our memory, remembering a specific set of movement. And as I watched her slowly progress with the disease, and then her decline of ability to remember, was a really fascinating experience to watch, and challenging, but pretty amazing to see. And kind of toward the pass, it really required that I had to kind of almost like let her lead. I'd do triangle pose, and I would look over, and she would be and then once I learned that if I supported her and just said, "Great, Mom, you're doing a good job," and not try to get her to do exactly what it is I thought was what I should do, then things got really fun and interesting. I'm curious, what are you noticing within the Alzheimer dementia world in relation to progress, and/or sometimes I'll hear people say there's been no progress, or in the science community around the specific diseases?
Yeah. Alzheimer's has been, I think, one of the most challenging diseases in all of medicine, because it is very prevalent, meaning a lot of people suffer with Alzheimer's, a lot of families suffer with Alzheimer's, and the entire pharmaceutical industry and research industry that's been trying to come up with cures or at least treatments has really only produced 2 medications that work barely. And there are some new medications coming out now that are extremely controversial. I personally have never prescribed them, and I need to see a lot more data before I would. But one of them is called Aduhelm or aducanumab. And the other one I'm forgetting the name of, but it's like lacazumab or something like that. And these are really interesting. I mean, I don't know if we want to go into the pathophysiology of Alzheimer's too much, but these are really interesting because they target what is thought to be the causative molecule, like the molecule that makes a brain develop Alzheimer's. These are antibodies that are manufactured to bind that molecule and pull it out of the brain.
Wow.
And they kind of work. they definitely pull the molecule out of the brain, meaning like you can do scans and see that the molecule's gone. But at the same time, the cognition, we're still seeing if it stops getting worse, but it definitely doesn't get much better from doing that.
Got it.
So either the damage is already done, and we're going to see a stabilization in people treated with these medications, or we have the whole model of how Alzheimer's works wrong, which would be devastating. But what I will say is, based on a lot of research, there's a huge lifestyle component to dementias, and there's also a genetic component, of course. And we know some genes that can be tested to measure risk for Alzheimer's. And then the lifestyle things are the things that everyone kind of knows. So exercise, healthy diet, particularly a Mediterranean diet, the social engagement, so having friends. I think the way it was framed in many of the studies is having someone to talk to. Like if you have a problem, you have someone to talk to. And that was like predictive of preventing or slowing Alzheimer's. And other ones actually include air pollution and so many more. But I do think that yoga as an intervention can address some of these lifestyle factors.
Very cool. I'm curious, what is the controversial element of that medication? You said it's very controversial. What is there a side effect that's horrendous?
Yes. So it's not a horrendous side effect, but it's one that we're still kind of interpreting the meaning of. So they're called ARIA, which stands for, I forget what it stands for, but it's basically imaging findings. So if you get an MRI on someone who's on these medications, they will have these not good looking imaging findings, but they won't have any symptoms or deficits referable to it. So we kind of tolerate it. But you're just like, what exactly is this? And if they get bad enough, you are supposed to stop the medication. So you're supposed to screen for these if someone is on the medication. And really what they are is edema, which means swelling, and also hemorrhage, which means bleeding. And both of these are in the brain. And so you see imaging findings of this, but people don't feel it or notice it or have any, even if you look for it on exam, they don't have any deficits from it.
Got it. Interesting.
Yeah, it's a new medication. All new things need to be tested and figured out. The other thing that I think is really controversial about this medication, which there's a total opposite of yoga, right? But yoga has been around for 5,000 years. This medication's brand new, and it actually was put through an accelerated FDA process. So that means that it didn't go through the same stages of clinical trials and was approved more quickly, with the reasoning being that there is no approved medication for Alzheimer's that really works right now. So we have, something that could work, like let's get it out to people. And that's also where some of the controversy comes from. Like we should have tested this more.
That's interesting. Are your colleagues, what percentage, if you had to take a random guess, agree with you in relation to the positive effects of yoga used in conjunction with Western medicine. Do you find it's like 50-50? Do you feel like it's more the majority are agreeing with you that yoga is a great thing to use in complement with the therapies that you're also working with people with?
I don't think anyone disagrees.
Mm-hmm.
It's a huge topic. I don't think that many people will regularly offer yoga, though I will say once I was with the chair of my department in his clinic, and there was a patient who had something that has been shown to benefit from yoga meditation interventions, and he was like, "Oh, you're with Dr. Rosenthal, the perfect person. He could teach you some yoga for this." He said it sort of as a joke, but it made me realize that he actually does incorporate this in his practice. So I don't have a number, but I don't think it's as abysmal as people think. I really do think that it is in people's minds, and it is something that the evidence has made its way to people's desks.
Yeah.
Jonathan, are you still teaching classes in the hospital?
I haven't taught in the hospital, but I've been teaching at Dharma and inviting people from the hospital.
Very cool.
Yeah.
Nice. Sarah, what are you noticing in your teaching? You're currently living in San Francisco. Am I correct?
I'm in the East Bay, so I'm in Berkeley, San Francisco Bay Area.
Are you back teaching in public scenarios? Are you still predominantly working in the Zoom realm?
Oh yeah, I was really reluctant initially to do Zoom. I had for several years had some clients that I would do more like FaceTime with, and Skype, which was the predecessor really for Zoom, but I didn't do group classes. I would do one-on-ones online, and it was occasionally with some private clients. And mid-April of 2020, I started offering group online public classes. That went on for a solid 2 years. I have, at this point, great screen fatigue. I'm not offering any public online classes at the moment. During, I think it was end of summer 2020, I started collaborating with a local surf shop called Traveler Surf Club in Pacifica, California, which is about 30 miles south of Berkeley on the coast. And I offered a weekly beach yoga class, which was incredible. It ended up being really a pillar of support for both myself and for the community that grew through it. It was a collective of community members, people who were members of Traveler, so surfers and swimmers, and basically during at least the first 6 months of that class, it was every Saturday morning, there were a number of students who would tell me, for example, that myself and the people in the class were the only people that entire week that they were in touch with. And it was really powerful because it resonated with me. I was isolated. I live alone. And it was the same. I was like, same for me. Like I've seen my neighbors, and I've gone I would go swimming in the bay with my neighbors. That was a pandemic thing that I did. Anyways, long story short, I taught about 75 classes on the beach before letting that offering go. And for the last 2 or so months, I haven't taught any group classes. I'm kind of getting a feel for what exists at this point in time in terms of studios where I would want to teach indoors. But 3 of the studios I used to teach at in San Francisco have shuttered since the pandemic. So the landscape of yoga studios in San Francisco has greatly changed. There's no longer as many small independently owned studios like there once was. And those were my favorite to practice and teach at, because they were real shalas, they had heart and soul, and they were community spaces. And when you get more corporate style studios. It feels to me a bit sterile, and it's more of a business. It just doesn't resonate. So anyways, yeah.
Interesting.
Yeah.
I appreciate you sharing all that. I love
Yeah.
hearing what's happening in other parts of the country. Jonathan, what is your take on like the yoga scene now in New York?
It's poppin'. Dharma's classes are full again. Dharma in 2019, in November of 2019, moved to a much smaller space, which was just, he's psychic. I mean, come on. How did he like downsized right before COVID, you know? But the old space used to hold like 130 people. The space holds about 70. And now it's full again, and it's really nice. Yeah,
Cool.
it feels very alive.
That's so cool. And Dharma does have superpowers.
Right?
Yeah, I've experienced them. Yeah, he's
Doesn't
next.
he to develop your psychic abilities?
So Dharma does teach classes that have to do with developing psychic abilities, but when he talks about them, he says he's talking about the psyche as like, your own self-control and your self-regulation. And I think that's appropriate, right? Because the yoga teacher is supposed to hide their cities.
Right.
And I obviously think very highly of Dharma, and so I do think that there's something there.
Yeah. Do you ever feel like there's some tension in the medical community to the, like, say, spiritual side of yoga, or do you feel like that's starting to blend a little more harmoniously?
I think that's going to be much harder to blend harmoniously. And I think it really stems from just a fundamental different belief about how the world works. If you believe that everything is based on physics versus everything is based on metaphysics, then you're going to disagree.
Good point. Where do you fall into all that, Jonathan? I mean, I understand it's a private question, and I understand if you prefer not to go there, but I'm just curious, how do you reconcile that on a personal level?
I believe there is physics, and I believe there is metaphysics, and I believe they are the same thing viewed from different angles. So it's like if you're perceiving it from the outside, that's physics, and if you're perceiving it from the inside, that's metaphysics.
Very good. Great answer. And I'm curious. Well done. I'm curious, if you dream your, like, what this conference is going to, what sort of positive effects this conference would have if you could map out what the outcome would be, what is your vision or dream for this?
Yeah, so everyone's starting at a different level, right? So people are going to come to the conference with different knowledge bases. And the goal is that everyone will leave with tangible evidence of this is something that yoga helps, that I'm really interested in, and I can now advocate for that.
Nice.
So that's one really measurable outcome, I think. And the way I measure that is feedback surveys at the end. And I ask questions like that. And everyone is always saying, I'm going to go to my child's school and request that instead of PE, they're able to do yoga, something like that.
Yeah. Yeah.
And the other things that I think would be really great are for the researchers. I think that when you're kind of isolated from the talk of the town in the yoga world, you sort of, I don't know, you get stale, your ideas aren't as fresh. And I think that connecting with everyone is great for the researchers because now they have new, exciting ideas for their research projects.
That's cool. That makes sense. Yeah.
So those are two of my really beautiful outcomes I hope for.
Nice. Sarah, what about you?
I think in general, the conference builds community. And so that's really lovely, whether it's like-minded people like maybe not like-minded, that's not the best way to say it, but perhaps someone like Todd, perhaps someone has a parent who's going through a similar situation, and they can learn about how different interventions to help their parent or their child, or whether you're a student learning for yourself, or a teacher of yoga and meditation, or a researcher like Jonathan said, and you're bouncing ideas off of people you've just met, and all of a sudden through that collaborative process and that brain trust, you come up with a new exciting idea to explore. I think that in general, it's just this beautiful matrix of people who have this common denominator of interest, and it opens doors. It opens the mind. It's expansive. I love it. It's so expansive.
Well said. Nice. That's amazing, you guys. Well, I am so thankful to have this opportunity to speak with both of you through this medium. I have the link in the notes below. So if anyone's interested in checking out the conference and the website, that's really easy to find. It's in the link below. And so you can obviously click there. If Jonathan, I noticed that you have you have an Instagram page. Can you remind us your Instagram page name?
Yeah, it's Neuro, Yoga, NYC.
Cool. I just went ahead and followed you over there. Sarah, if we were to follow you on Instagram, are you doing that these days?
I have been trying to step away from it more recently, but I am on there. It's my name that you can see on the screen. It's at Sarah Margaux, SarahMargaux. So you're welcome to follow along if interested.
And
but Jonathan's the real person to follow. Jonathan's going to have super cool stuff regularly posting about the conference.
Well, I'm really excited. Jonathan, I know we just have an hour together, and we can only cover so much, but did I miss something that you want to share or talk about in addition to what you've already shared with us?
That is everything on my end. I'm really grateful to meet you and to have the time to talk. I thought the questions were really stimulating, so thank you for all of those questions. I don't often get to talk about metaphysics. So yeah, please keep in touch, and thank you again.
Thank you. Sarah, do you have any final words, wishes, or thoughts?
Well, I guess my wish is that this discussion is of benefit for people, and that more people are inspired to join the conference and check out all of the exciting speakers, presentations, yoga classes, and do some experiments and see how science and yoga intersect.
Nice. And it really is impressive, Jonathan. When I checked out your website and I saw the crew that you have presenting, it's really amazing. It's funny because after I looked at and I read everybody's bios, it made me think I want to go back to school and get my I want to become a doctor.
Todd, I've been thinking that same ever since I met Jonathan and have been introduced to this conference. That has been the biggest thing I have deliberated in my mind, is if I'm going to go back to school and delve into some area of this topic, it's right with you.
It's so cool. It's so cool. I came home and I told my wife that, and she just kind of looked at me like, all right, well, sign up. She did laugh a little bit when I said I want to be a doctor all of a sudden, but honestly, the group of people and the bios, I recommend everyone who's watching this to just go check out the website and just read through the bios of everybody. It's really inspiring, and it's got such a wide range of, you're covering a lot of bases. So it's extremely impressive. I really can't wait to be a part of this, and just hats off to you for organizing an event like this. It seems like a lot of work. So that you're working doing a residency and putting this together and taking time to speak with us is impressive as well. So thank you so much.
Clearly, I'm sorry, I'm going to jump in. Clearly, all of the practices that Jonathan has learned from Dharma are paying off, because Jonathan has some superpowers too to be
Right, right.
I was going to say it's all the speakers. They're making the presentation. So
I hear you, man. Cool. Well, thank you so much, and we'll be in touch.
yes, I'm looking forward to it. Thank
All
you
right.
both so much.
Thanks, thanks, Todd.
Thanks, Sarah.
Thanks, Jonathan.
Thank you.
Thanks, everybody, for joining.
Thank you.